sleep apnea and how does it affect our respiratory system and overall health of our body. Sleep apnea is a disease where our respiratory tract just behind our tongue, the upper respiratory tract, it gets shut down during when we sleep. It occurs very frequently during the sleep, which is a normal physiology of the sleep. The patients who have sleep apnea, in these patients this occurs more frequently during the sleep. It may shut down for minimum 10 seconds or more during at the time of the sleep. So if it occurs very frequently, then obviously your respiratory system will completely shut down, your oxygen will drop during the sleep, which may lead to severe respiratory problems, like if you have any underlying airway disease or obstruction in your airway tube, then it will get worsened with the uncontrolled sleep apnea. So it is very important to diagnose and treat sleep apnea. Sleep apnea is one of the kind of disease which is not imminently life-threatening, but yes, it has many medical implications in our body. Like if we sleep and if our airway is shutting down during the sleep, oxygen can drop to a critically low level. We have seen very often oxygen dropping up to 60% during the sleep. So you can imagine how severe it is. So during that time, our body is at maximum stress level. So many stress hormones are released during the sleep, which causes your blood pressure to shoot up during the sleep. You may develop heart attacks or stroke during the sleep, disturbed cardiac rhythm during the sleep. If you have diabetes or blood pressure, it can lead to uncontrolled diabetes and blood pressure. So sleep apnea has an overall great impact in our metabolic system of our body. Sleep apnea can definitely lead to respiratory disorder because uncontrolled sleep apnea will definitely increase your respiratory problems. Eventually you are prone to develop hypoventilation syndrome, in which your oxygen levels are persistently low and your carbon dioxide levels in the blood, it causes rising, so which leads to respiratory failure. So this type of problem can be serious and lead to ICU admissions, recurrent admissions, or maybe it may lead to patient may require ventilatory support also if this worsens. If you have uncontrolled sleep apnea, if your respiratory system, upper respiratory system gets shut off during the sleep, then your brain gets signal that there is something happening in your upper respiratory system. It will sense that your airway has shut down. It will send signals to these muscles. Then you will have normal respiratory activities. Again it will shut down. Again brain gets awake and it will send signals to these muscles. So during this process, your brain does not sleep whole night. So your brain needs rest during the day. So what happens, you will feel sleepy during the day, and if it is more severe, then sometimes patient also suffer from temporary memory losses, cognitive difficulties, which may in turn lead to intellectual loss as well.